Pleasure to invite Dr. Hyun Shin, who is going to talk about what's new in pediatric neuroophthalmology. Over to you, Dr. Shin.
Okay, so thank you for your kind introduction. I'm from South Korea. My name is Jin. I would like to thank you, Dr. So, and organizing committee for putting together this wonderful session. And the topic of my presentation is what's new in pediatric neuroophthalmology. Unfortunately, I have no financial disclosure. And to begin, I ask ChatGPT, please draw a picture that is the topic of today's presentation. And it creates this following image. Interestingly, artificial intelligence technology like this already is being used in the field of pediatric neuroophthalmology. Previously, Donnie saw beautifully describe how it used in traumatic retinal hemorrhage in pediatric cases. Today, I will talk about three main topics: advancing diagnostic technology, and updating treatment, and newly emerging diseases. By the end of this talk, I hope we will all gain a clearer sense of how the future of pediatric neuroophthalmology is evolving. Let's start with advancing diagnostic imaging. Here is an OCT image in the past and now, and recent technology advancement have led to development of a handheld OCT combined with a fundus camera. So these are now available not only in emergency setting but also widely in pediatric ophthalmology. Especially these tools are used for evaluating optic disc swelling and monitoring pupil edema. With the integration of AI technology, real-time detection of diseases have become more accessible. The Bonsai deep learning system analyze over 15,000 fundus images and demonstrate excellent performance in detecting pediatric pupil edema, achieving an AUC close to 0.99. This technology helps clinicians distinguish true pupil edema from normal or abnormal optic nerve, even in remote or underserved area. AI research is also expanding beyond the imaging, beyond just the analyze static imaging, and into dynamic eye movement analysis and strabismus diagnosis using auto-segmentation technology. Now let's talk about treatment. Virtual reality devices are now being used not just for gaming, but as digital therapies. Luminopia, for example, is an FDA-approved digital therapeutics for treating amblyopia. In South Korea, digital devices have been approved for treating homonymous hemianopsia caused by brain lesion and commercially available. These digital therapies are especially effective in children because they are engaging and user-friendly. These tools are now being used to help children with cerebral visual impairment, CVI, which is a leading cause of visual impairment in children with special needs. A study using Vision Nanny, a web-based platform for children with CVI, showed that all 35 participating children aged 9 months to 5 years demonstrated improvement visual attention and engagement. Overall, digital intervention was found to be more effective and received a higher satisfaction rating compared to conventional methods. There are also advancements in pharmacologic agents. Optic pathway glioma represent about 5% of pediatric brain tumor and occur 15 to 20% of the children with neurofibromatosis type 1. MEG inhibitor target the overactive RAS pathway, blocking the MEG enzyme to reduce tumor growth. This drug can be taken orally, not IV, and cause less immune suppression compared to traditional chemotherapy. Let's move on to the last topic, newly emerging diseases. The first emerging condition is visual snow syndrome, a neurophthalmic disorder characterized by persisting flickering dots across the visual field. Patient may also experience after image polynopia, plotter, photophobia, and dictalopia. This condition, first defined by Dr. Granty Liu, a neuropediatric neurophthalmologist in Philadelphia, is often misunderstood. In our recent study of 63 patients, 22% experienced symptoms before their age 15. But unfortunately, many were initially misdiagnosed as just having vitreous floater regardless their age. So in visual snow patients, filter glasses such as FL41 lenses can help alleviating their symptoms. Also, I believe that patients should avoid refractive surgery like a LASIK in adulthood, as these may worsen their visual snow symptoms. Let's move to MOG optic neuritis. It is important to remember that optic neuritis is just a clinical diagnosis. It needs to be proper classifications. The first tier is either autoimmune or infectious systemic. In autoimmune categories, specific biomarker help guide diagnosis. One such a biomarker is the myelin oligodendrocyte glycoprotein antibody, MOG antibody. MOG positivity is observed in 25% of the children experiencing their first demyelinating events of isolated optic neuritis. MOG optic neuritis has traditionally considered more monophagic in children. However, long-term data reveals that the relapse risk in pediatric patients approaches that of adults over time. At 2 years of follow-up, the relapse rate is lower in children than adults. However, with 5 years of follow-up, both groups show a relapse rate approximately 67%. This suggests that long-term monitoring is important for pediatric MOG optic neuritis. In terms of relapse prevention, I believe that tocilizumab is currently considered most effective, followed by IVIG, rituximab, mycophenolate, and azathioprine. So, phase 3 clinical trial for acetylizumab subcutaneous injection is underway for patients aged 12 and older with MOG optic neuritis. I believe that good treatment for treating MOG optic neuritis will continue to evolve. Finally, let's talk about hallucinogen persistent perception disorder named HPPD in adolescents. HPPD is non-psychotic disorder where patients experience persistent visual hallucination or perceptual distortion after using hallucinogenic drugs. Adolescents' drug abuse is a raging concern, even in South Korea. At least 1 in 8 teens have used illicit substance in last year. In teenagers with visual symptoms like polynopia or hallucination, it is important to screen for drug use and differentiate HPPD from primary psychotic disorders. Treatment may include mood stabilizer such as benzodiazepine or antipsychotic medication like aripiprazole. In conclusion, today we explore recent technology advancement in diagnosis and treatment and newly imaging diseases in pediatric neurophthalmology. Pediatric neurophthalmology is not simple neurophthalmology for small adults. It presents unique diagnostic challenges and highlight the critical importance of early intervention to prevent lifelong visual impairment. As the technology and interdisciplinary care continue to evolve, our field is uniquely positioned to safeguard children's vision for the future. Thank you for your time and attention.
Thank you, Dr. Shin, for the wonderful presentation. I just had one question. You said visual snow syndrome has become very, very common, and most of the patients are very happy that somebody is agreeing with their symptoms. Do you know any advances in the treatment?
Oh, that's very great question. So, in my study, I believe that filter glasses provide partial reliefment in more than 40% patient. And lamotrigine, unfortunately, that's the primary medication for visual snow, but it only provide partial relief only 20%. But I believe that you're right. Most of the patients, they are very grateful for just saying that it's a disease, it's a functional disease. You are not gonna blind, and so don't worry about too much. Don't focus on the small dot, just to, see your future. So saying like that, most of the patients, they feel relieved. You're right. But I believe that in future, we also did a clinical trial for electric therapeutics, trigeminal nerve innervation therapy. So this kind of future therapeutics will treat their symptoms, not just only saying that you are not blind. Some of them really, they suffer from depression, anxiety disorder with the visual symptoms.
Absolutely. Any other questions from the audience?
That's a great question. If patient unilateral, that's not a visual snow syndrome. Visual snow is a brain problem. They complain of bilateral, simultaneous, similar pattern of noise and dot in both eyes. Even though they close their eye, they feel that. There's a brain hyperactivity problem, not an eye problem.